When you think about hospitals and emergency rooms, you often associate those images with life-threatening situations like serious car wrecks or building fires. But as we move further into the fall season, smaller but still significant everyday activities can lead to medical emergencies. For the next few minutes, we'll look into that aspect of health and safety and a few other medical issues in our area with Connie Stone, who's Vice President of Patient Care Services and Chief Nursing Officer for Montgomery General Hospital. Good to see you.
Good, thank you.
And you've also run the emergency department at some point, too, haven't you?
I have run several emergency departments in my past, but yes, at Montgomery General is where I started. At Montgomery General was in the emergency department.
Yeah, that must be quite, I don't want to use the word exciting, but you see a little of everything in that setting, don't you?
You see a little bit of everything, the best of humanity and the worst of humanity in the emergency department.
Yeah. Let me start with just a general question about the role of a hospital. When should a person go to the emergency room rather than visiting a doctor?
Well, I think there are times when you should never delay, and that's for people who are having chest pain or having shortness of breath or anything that they might consider a life-threatening situation. The doors are open 24 hours a day, 7 days a week, so it's there for everybody to come in who feel like they cannot wait to see a physician the following day.
Right. I've sort of seen a trend over some years that a lot of people will use hospital or emergency room kind of as their regular doctor. Does that still happen? Is there a reason for that?
Happens a lot. We've seen an increase with the as the economy has had its downward trends in the last few years. So people that are without employment, without health care insurance, will use the emergency department as the primary caregivers. And also it's convenient. You don't have to wait 2 or 3 or 4 days to get in to see the physician of your choice.
Yeah, you get some kind of an injury. It could happen 8 o'clock, 9 o'clock at night, or on a weekend or something. It's harder to get to a doctor.
Correct. Harder to get to. And as I said, there are people there who can take care of the most life-threatening illnesses or injuries. So, you're in very competent hands when you go to an emergency department.
Yeah. Let's look at a couple of specifics that relate to fall season. I mean, there's a lot of potential medical issues that, the shorter amount of daylight. There's Halloween coming up, Thanksgiving, colder weather. Let's look at a couple of those specifically. Halloween, the parents, trick-or-treaters, there's potential things that can happen. What should parents be thinking about with that? And then if something does happen, what should they do?
I think the first thing to do is to prepare with some foresight. Make certain that you're going in areas that you're familiar with, areas that are well lit, that you carry some kind of a flashlight or some kind of illumination, so that yourself and your children are able to be seen by other people.
Right.
And again, only go to to areas that you're familiar with. Don't let the kids eat any candy or take anything from strangers until they've had a chance to inspect it, make sure that it's not been tampered with.
Right.
We always see amount of falls and injuries because people are out, around at nighttime, and a lot of times in areas that they're not familiar with. Plus, they have things on that hinder their eyesight. Mm-hmm. So again, monitor your children and make sure that they're going to be safe and that they're going to be visible by other people.
Yeah. Do you see more people coming in the emergency room at Montgomery General around something like Halloween?
Actually, during trick-or-treat, the emergency department's going to be pretty dead.
Yeah.
It's afterwards that we start seeing people come in. Same thing with Super Bowl Sunday. Nothing is going on in the emergency department during that time. And then after everything that's waited until then, people start coming in after those kind of events.
Right. And we think about Thanksgiving as being, such a great time of year. But as a colleague pointed out to me the other day, it's, you can cut your finger trying to carve the turkey and that kind of stuff. Do you see more activity around that kind of thing?
Holidays are very busy for a couple reasons. Is people are traveling, so even if it's local travel, people typically want to spend that kind of time in groups, with families or friends that they care about. Mm-hmm. So people are out and about traveling at times that they might not be, and then again, you have a lot of people in a small area, so. As you said, burns, some kind of, maybe cuts, different kind of injuries that would occur just because of the activity that's going on that's not probably a normal part of the household.
Right. Changing subjects just a little bit, flu season, flu shots, that kind of thing. There's a lot of stuff last year about the H1N1 and other things like that. What's different, or is there anything different this year?
I think this time of the year is always it's hazardous because of the flu season. For people to take normal precautions is sort of something we'd like for them to do every day, but especially in this time of the year when people are more confined. Hand washing is the number one thing that people can do to protect themselves and their families from catching diseases. Making sure that they clean surfaces that you normally might not think about, such as doorknobs and telephones and shopping carts,
Keyboards.
Yeah. Again,
we're in a room full of keyboards here.
Yeah, that type of thing. At Montgomery General, we've all of our employees get a flu vaccine, and we do that not just to protect the employee, but also to protect our patients that come in, because they're much more vulnerable when they're ill and they're in the hospital than they would be under normal circumstances.
Yeah. Who should get flu shots?
Basically, anybody over the age of 6 months can take the flu injection. Certainly people who have any kind of chronic illness or past health problems, or if your work or your activities put you in a position that you're going to be in a lot of confined space, such as people who travel for business, so that they're sometimes in crowded airports and airplanes for extended periods of time, so are going to put them at higher risk than the normal population.
Yeah. We're talking with Connie Stone, Vice President of Patient Care Services and Chief Nursing Officer for Montgomery General. We're talking about fall and about holidays. Blood donation is always down at holiday time.
And the need is up.
Right, and the need is up. How do you handle that? And do you have any specific things coming up that deal with that?
We do blood drives periodically at the hospital. We encourage our employees to contribute, and also we open it for the community. On December the 23rd, we do have our next blood drive, so we would encourage anybody in the community or any of your listeners to come by the hospital and think about donating a pint of blood for the cause.
Yeah, it's pretty painless.
It is pretty painless.
I'm saying that it's been forever since I've done that.
It is relatively painless. It doesn't take much of your time, and it can save a life. So it's a worthwhile thing to do.
Yeah, good. And there's no safety issues relating to blood donation anymore, is there?
No safety issues.
Yeah, excellent. Well, another thing with the colder weather, this is sort of it's gotten us a laugh, but it's a piece of reality. The blizzards last year, about 9 months ago. So what are you seeing now at Montgomery General relating to that?
Well, we call what we've been seeing our blizzard babies, and we have seen an increase in the last probably 4 weeks, and we actually are anticipating a continued increase in the volume of deliveries at the hospital as a direct result of the blizzards that we had last year. The maternal newborn center at our hospital is a very nice place to spend the time when you're delivering your new baby. It's been recently remodeled. It's very private. We spend a lot of time on the security for the mom and the babies, so that you don't have to worry about the safety of yourself or your child when once you are in the hospital and you've had your delivery.
Right. And your hospital's no rookie in the hospital business. It's been around quite a while.
Yes, we have. And we have most of the members of our medical staff are board certified in their specialties, including the obstetricians. And we have an association with Georgetown University Hospital for the neonatologists. So you have top-notch docs trained who are taking care of the babies once they've been delivered.
Right. Yeah, I was going to ask you about that because sometimes you think of a hospital as where you go to the nearest one and you hope that it's good. So, I mean, obviously yours has a good reputation, but there are some areas where there's a benefit to interacting with other hospitals too. So that would be one of them, right?
Right. That is one of them. One of the things with Montgomery General is there is a Medicare Excellence Award, and Montgomery County is the only hospital in Montgomery County who's been awarded the Medicare Excellence Award. And we actually just found out this week that we've qualified for the award that will be given for this year, for the care given this year. And so it's care that's monitored by CMS, so by the federal government, and it's in areas of pneumonia and acute heart attack, acute MI, surgical safety for the surgical patient and pneumonia patients. So some pretty common diagnoses that bring patients to the hospital, and there are national guidelines about how quickly you should provide the treatment and how effective the treatment is. So we monitor that.
Yeah.
So again, you do, and a lot of things, have a choice about where you pick your health care, and Montgomery General is proven to have the quality that you would want to look at as you're selecting your health care providers.
Right. And I know I was focusing a lot on the emergency aspect of this earlier in our conversation, but certainly that's just a piece of the puzzle. There's, all kinds of the healthcare. I'm thinking we're still in Breast Cancer Awareness Month, and
We are.
you have a lot of activities relating to cancer too.
We do have a lot of activities related to cancer. I'd mentioned Georgetown neonatologists. We also have an association with Georgetown for oncology services. So for patients that have an oncology diagnosis that need to receive treatment, we have physicians from Georgetown University Hospital who are coming to the hospital with their practice, and we're actually delivering the care at Montgomery General Hospital. And we also have other board-certified oncologists on staff who've been providing the service to the community. So we wanted to open up a little bit more intense, higher level of care for people to be able to be treated in their own community instead of needing to go to a tertiary, big university setting to get the care that they deserve.
Yeah, excellent. And I told you before we started, time flies by. We have about a minute or two to go. Is there anything else that you'd like to add or repeat?
Well, you mentioned the emergency department. We do have a brand new facility in the emergency department. It's about 20,000 square feet. We opened in March. It has 41 rooms. Well staffed by board-certified physicians and nurses who are certified in emergency care. As part of that, we have, within the emergency department, we have a pediatric emergency department, so a locked area that our pediatricians are trained both in emergency medicine and in pediatric care, so can treat children of 18 and under for pretty much all ailments that come in.
Right, sure. That has to be a whole different kind of thing.
It's a whole, whenever you're dealing with the young child, the very young child aren't always able to give you the history that you need to be able to make a good diagnosis and then treat them. We also have an urgent care portion of the emergency department for very simple illnesses or injuries that our goal is to get folks in and out in 90 minutes or less. So a goal that we strive for every day.
Yeah, excellent. All right. And if someone wants more information about the hospital, the website is
www.montgomerygeneral.org.
Excellent. All right. Connie Stone, Vice President of Patient Care Services and Chief Nursing Officer for Montgomery General, and well-versed in the emergency side of things as well. We thank you for your time.
All right. Thank you very much for having me.
And best wishes on the blood drive in December as well, and information about that also on the website.
All right. Thank you.
Excellent. And I'm Bernie Lucas. Thank you for listening.